Good evening. Thank you very much for joining us here on Urban Debate on Mirror Now. I am Heena Gambhir. Looks can kill. An incident in Bengaluru is a testimony to these words. 22-year-old Chethana Raj, well-known actor in the Kannada Daily Soap industry. The industry was in a state of shock today after hearing the tragic news of Chethana's death. On May 16, Chethana went to Dr. Shetty's cosmetic clinic in Bengaluru as she wanted to undergo fat-free plastic surgery without telling her parents. Everything seemed fine initially. Late evening, she started developing some sort of uneasiness. She was then immediately rushed to another hospital. The doctors at the hospital declared her brought dead. Now, initial reports say that fluid accumulation in her lungs was the reason behind her death. Chethana's family is alleging negligence by doctors who conducted the surgery. A case of unnatural death has been registered and the probe is underway. And before I go across to my colleagues who are tracking this story very, very closely from the state of Karnataka, let's listen in to what the family members of Chethana had to say.
ಇಲ್ಲ ಈ ಸರಿ ಏನು ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ದು ಅಷ್ಟೇ ಬಟ್ ಇವತ್ತು ನಿನ್ನೆ ಹೋಗ್ತಾಳೆ ಅಂತ ಗೊತ್ತಿಲ್ಲ ನಾವು ಸೈನ್ ಮಾಡಿಲ್ಲ ಆ ಫ್ರೆಂಡ್ ಏನೋ ಸೈನ್ ಮಾಡಿದ್ದಾರೆ ಅದೇ ಡಾಕ್ಟ್ರು ನಿರ್ಲಕ್ಷ್ಯತೆಯಿಂದ ಮಾಡಿದ್ದಾರೆ ಅಂತ ಈ ಥರ ಆಗಿದೆ ಅದಕ್ಕೆ ಅವರೇ ಹೊಣೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಕಂಪ್ಲೇಂಟ್ ಮಾಡಿದ್ದೀವಿ ಪೋಸ್ಟ್ ಮಾರ್ಟಮ್ ರಿಪೋರ್ಟ್ ನೋಡಿ ಆಮೇಲೆ ಮೇಲೆ ಏನು ಮಾಡ್ತೀವಿ
ಇಲ್ಲ ಏನೂ ಮಾಡಿಲ್ಲ ನನ್ನ ಸೈನ್ ಏನೂ ಮಾಡಿಲ್ಲ ಕಣಮ್ಮ ಅವ್ರು ಕೇಳಲು ಇಲ್ಲ ಸೈನ್ನ ನಾನು ಹೋಗೋದಕ್ಕಿಂತ ಮುಂಚೆಗೆ ಕರ್ಕೊಂಡು ಹೊರಟಾಗಿದ್ರು ಮಾಡ್ಕೊಂತೀನಿ ನನ್ನ ಫ್ರೆಂಡ್ಗಳು ಬರ್ತಾರೆ ನೀನೇನು ಬರಬೇಡಮ್ಮ ಭಯ ಬೀಳ್ತೀಯ ಅಂದ್ಬಿಟ್ಲು ಆಮೇಲೆ ನಾನೇ ಆಟ ಮಾಡ್ಕೊಂಡು ಹೋದೆ ಅಷ್ಟೊತ್ತಿಗೆ ಕರ್ಕೊಂಡು ಹೋಗ್ಬಿಟ್ಟಿದ್ರು ಸೆಟ್ಟಿಲ್ಲೇ ಅಲ್ಲೇ ಆಪ್ರೇಷನ್ ಮಾಡಿದ್ದು ಅಲ್ಲಿಂದ ಆಗಲ್ಲ ಸೀರಿಯಸ್ ಆಗಿದೆ ಅಂದಿದ್ದಕ್ಕೆ ಕಡಿಯಾಗಿ ಕರ್ಕೊಂಡೋಗಿದ್ದು ಅಲ್ಲೇನೂ ಆಗಲಿಲ್ಲಮ್ಮ ಎಲ್ಲ ಇಲ್ಲೇ ಆಗಿದ್ದು ಇಲ್ಲೇ ಹೋಗ್ಬಿಟ್ಟಿತ್ತು ಜೀವ ಇದರಲ್ಲೇನೆ ಸೆಟ್ಟಿಯಲ್ಲೇನೆ.
My colleagues are now joining us on the broadcast. We have Thoya Jakshi and Neha Hebale joining us live for more on this big story. Good evening to both of you. Thoya Jakshi, I want to begin the discussion with you. You met the family members of Chethana today. The family clearly is in a state of shock. What happened is unbelievable. Can you explain to us what exactly they told you? And because there are claims and then there are counter claims coming too.
Yeah, well, when I actually met Chethana Raj's parents at the funeral today, the mother also told that when Chethana Raj was going to the surgery, Chethana Raj specially told her mother not to come to the surgery because she will get scared by seeing the surgery. That is why Chethana Raj had to take her friends to the hospital while the surgery is going on. And specifically, one of her friends had signed a form, the declaration form, that and also that she had not informed her dad but that she's going to get this surgery. And right now they're in a very shocking. This is what they said. Both the parents. This is what they said.
Okay. Neha, what is it that the hospital here has to say? What have you picked up from the cops in the case so far? Because we are also getting to know that she was immediately rushed to another hospital where the doctor who had conducted the surgery threatened the doctors in that hospital to treat her as a person who had suffered a cardiac arrest. Can you just bring us up to speed with what you have gathered so far?
Well, absolutely, Heena. In fact, what we do know is that the surgery was conducted on actor Chethana Raj last morning. And, after this was when we saw towards the evening that she started developing some uneasiness. Her parents also, in fact, did happen to mention that there was likely some water that had filled up in her lungs. And which is why, owing to the uneasiness, she was rushed to another private hospital, the Kannada Hospital, wherein over there, when, of course, she was rushed, she was run straight into the ICU. And the doctors at the Kannada Hospital happened to mention that she did not have a pulse at the time that she was brought in, meaning that she was declared brought dead. But despite that, on the insistence of, the family of Chethana as well as the doctors who had accompanied Chethana, on their insistence, they did, of course, attempt CPR on her for almost 45 minutes and tried to revive her. But despite that, we see how, her organs, of course, did not really respond. And in that unresponsive state, she was declared brought dead. Now, what is rather shocking over here, Heena, is that even as the police investigation is underway right now, and the Dr. Shetty's cosmetic clinic that's that's actually carried out this particular cosmetic surgery has been shut right now temporarily for pending inquiry. What's rather shocking is that at this point in time, the police, of course, is still investigating the case. There could be multiple angles to this. We've spoken to doctors, we've spoken to other medical professionals in the field as well. And there are, possibly two outcomes from this. One could have been the fact that, there could have been medical negligence, and ruling that out, the second or the alternative also could have been the fact that, her body, in fact, couldn't exactly have withheld the anesthesia that was administered to her. Now, was her, were all of these tests conducted in advance? That is something that the police, of course, would be probing right now, Heena, because one crucial aspect of any cosmetic surgery happens to be the fact that there is a pre-anesthesia test which is carried out on the patients or on those people who are, looking to get this surgery done. And were all those due procedures followed? That's something the police would be probing. And secondly, was her consent, of course, was a formal consent signed? Was she made aware fully of the post-surgery complications that may arise? All of these angles is what the police would be looking at.
Well, yes, those are pertinent points you have raised, and thank you very much for the moment, Neha, as well as Toya Jakshi, for joining us and putting things in perspective for our viewers. So on Urban Debate tonight, viewers, we want to discuss two things. Is it pressure to keep up with the new age fads leading to such incidents? Because remember, it's not the first time we have seen a plastic surgery going wrong in this manner. Is there need for regulation in this industry of cosmetic surgery? Joining us on the broadcast this evening are my guests. We have Indrajit Lankesh, who is Indian filmmaker, producer and director. Dr. Veena Singh, HOD Plastic Surgery, AIMS Patna, will be joining us. Dilip Cherian, founder, Perfect Relations, is live with us. Kasturi Shankar, actor and social activist, also on the broadcast this evening. Reena Dhaka, who is a fashion designer, also on Urban Debate with us tonight. Good evening to all of you. Thank you very much for joining us here on Urban Debate on Mirror Now this evening. Kasturi Shankar, let me begin the discussion with you. You're an actor yourself. Plastic surgery going wrong. We've heard this many a times in the past as well. What will you say about what happened with Chethana? Who killed Chethana?
I think it's obviously, first of all, my deepest condolences to the grieving family. It's a terrible, terrible thing to happen, that too to a very promising 21-year-old life being snuffed out. It's just incredibly tragic. I think a mix of factors all have contributed to this unfortunate death today. Number one, the movie industry, the television industry. As an actor, you live in a toxic environment where everybody is, you're surrounded by beautiful people. So you're always questioning yourself. You lose a contract, you think it's your fault. It's not. At my age and after 25 years in the industry, I can tell you it has nothing to do with you. But when you're 21, girls come in at a very young age without the right kind of solid support from their family, without the right kind of solid guidance from their mentors as well as their family members. Girls can be under tremendous pressure. They commit suicide. We hear of that in the industry a lot. And then this kind of self-image related issues. And social media is not helping. We have all these demands that are perceived by celebrities. Everybody is there. The whole world is commenting on every photo that you put on Insta. It is a pretty toxic environment to grow up in when you're barely out of your 20s. Third, attractive advertisements, all these mushrooming clinics. I think in India today, one side there are fertility clinics, and the other side there are fat loss clinics, cosmetology clinics. I'd like to share my own experience. About 10 years ago, I went in for a free offer from a clinic, one of those skincare, cosmetology, dermatology clinics, if you will. And they had a free offer, an attractive offer. They wanted me to come in. So I went in, okay? And after they gave me the facial massage, a skin doctor, a dermatologist, checks me out and says, how old are you? And I'm like, I'm 35. And he's like, see, and look at your skin. You could look so much younger than this. And I'm like, are you kidding me? Because I've always been known for my flawless skin. And here is a guy hard selling looks to me. He's telling me that he can make my skin look so much better and I look older than I need to look. And it was a hard sell. If it were anybody else there, if it was somebody younger or more impressionable, they would have gotten the idea that they're totally ugly and they need to sign up for every treatment they had on offer there. This kind of hard sell has become even more popular nowadays. And, people are advertising in every medium for the world. You can become somebody else. You can become Cinderella by midnight.
So there are misleading ads. That's one point you have raised, but I'm glad you shared what happened with you as well, Kasturi. And before I go across to my other guests, I want to ask you one more question very quickly. The pressure to probably go to a clinic like that and try what they can do with your looks, with your skin, was it from inside or did you feel like going there on your own?
That's how they pull you in. They pull you in with an offer for a facial massage or something. And you're thinking, hey, free stuff. Okay, in my case. But in general, even the ads, they don't advertise, we will take 3 kilos of fat out of your body. They don't say that. They say, we'll help you get fit. Right? And then when you go there, the hard sell is, look at you, you have to sign up for all these crazy radical treatments because you're plain damn ugly. And a lot of people will start believing that. And that's horrible.
Okay, so there are not enough details about post-surgery complications, but clearly there are misleading ads that we all have seen. We'll discuss the larger issue as well, Kasturi.
No, this is what plastic surgeons have to say. And
yes.
I know several people in the industry, several of my good friends are cosmetic surgeons. An ethical surgeon would look at a potential patient and say, you don't need anything, you're perfect, go back home. But what's happening in most of these establishments is, even a perfect person walks in, they're selling all sorts of treatments. In the end, it's half pressure from peers, half pressure from the hard sell. And then this person thinks they need all these, fat reduction treatments. You got to be notified of the consequences. Right. You have to have tests done before. You have to
absolutely. You need to be told about the post-surgery complications, the consequences. That is a very, very important point you're making. Reena Dhaka, you're a fashion designer. You've been part of the showbiz as well for a very, very long time. What will you say about what happened with Chethana and the pressure that many of these young actors and actresses face today in order to do better in their career?
I feel what a way to get a wake-up call, to have this tragedy bring to light such a fatal, obsessive reality of the situation and the world, this movie world, fashion, glamour, and today it is no more just them. It is real life people right next to your door, in your families, who are all falling prey to going against nature, to getting themselves artificially or surgically created to be looking like a Kardashian or whoever they want to be. And I really personally feel that there is no shortcut in life for everything. You have to work hard. So even if it needs to come to a certain size in life, if your aspiration is to be a 0 or a 5 or a 10 or something, you need to work hard for it. You need to eat right. You need to make certain right choices instead of going to surgeons. And yes, I agree with the fact that the medical healthcare system needs to be very responsible in informing people of the side effects of the post-surgery things for which they also need to be accountable. They in fact make you sign a document by which you really are a dead man walking into their hands. So I really feel accountability is also about ethics, and it's also about having healthcare wake up to realize that yes, they have a clientele probably in healthcare, but do they know the side effects? Do they go back and do a survey and research that how many people have changed, so have had life-changing problems occur to them with their, like Botox, I've seen people have had their face paralyzed and whole life has changed. Here, a girl has lost her life. I mean, it is so tragic. Though I do know as a normal person that bariatric surgery is considered to be dangerous and fatal. Was she warned? Did they inform her? I don't know how it happened, the series of events in her case. But in terms of social pressure, it's high time the society gets over this obsession of trying to be these dolls, of trying to look like each other, of looking like these clones. There was a song by Robert Palmer in the 90s where he made everyone look alike. Actually, there were many women, but they all look like one. We don't need to look like one. We're all unique. We all have our differences. And we need to learn from this very sad example that body shaming, size equality, these are important things. And we need to build them into mainstream cinema, into people who are, expected to be objet d'art, kind of on the face of television, in the face of cinema, in the face of social media. They don't need to be so perfect all the time. In fact, imperfection can be perfection too.
Well said.
So question is that pressure coming from within, or is the industry, if I talk specifically about the showbiz here, is the pressure coming from the industry? I'll get Indre to really talk about it, Indrajit Lankesh to talk about that particular aspect. But before that, Dr. Veena Singh, I want to ask you, doctors in this case specifically, of course,
there is
the
immense
investigation
pressure to
is
look
underway.
a certain way.
Reports suggest. Yes, Dr. Veena, 1 second. I want to ask you a specific question. Now, doctors in this case conducted surgery without parental consent and without proper equipment. That's what some, initial reports have suggested. I want to ask you, what is the procedure really? Here we are talking about a 22-year-old actor who's an adult, whose consent in a situation like this is required for you as doctors for a clinic, and what is the procedure that you follow to ensure that the patients know about post-surgery complications or the consequences that can be?
First, my deepest condolences for the girl and her family. And as far as the consent is concerned, she was an adult patient. Above 18 years, no parental consent is required at all. It is only for the minor. So the consent was well taken. Regarding the procedure, the cosmetic surgery is like any other surgery. You discuss with the patient regarding the steps required before the surgery, during the surgery, and what are the expected post-operative complications. So I'm very sure that the surgeon who have conducted the liposuction must have informed regarding the post-operative complications. It is true that within 24 hours of surgery, at least 1.5 patients out of 10,000 cases, they die within 24 hours. And the most common cause is cardiac arrest, which has occurred here also. And the reason for this in her case could be specifically either due to the anesthesia complication, which is again documented. This is a sad situation that a young girl has lost her life. But actually, these complications, these cases are reported in literature. And then another thing sometimes in liposuction occurs is the fat embolism, where while removing the fat, some of the fat goes into the blood vessels and it blocks in the lungs, which leads to oxygen insufficiency, and that leads to cardiac arrest. So that is also one of the documented complications. Nothing has gone very extraordinary, and a doctor, a patient, both of them cannot predict out of the whole list of the complication which will occur in which patient. So that is like it cannot be predicted. So 1.5 out of 10,000 cases, they fall prey to the post-operative complication, and there are mortality reported. But I'm confident that any surgeon performing the cosmetic surgery follows the proper procedure, is ready with all the equipments, is ready to manage all the complications.
Okay, so you're saying that just like all other surgeries, in this case also procedure probably was followed. I'll talk to you about the equipment issue as well. But before that, Indrajit Lankesh, is the pressure for actors, for people who are in the showbiz from outside, or do you think the actors, producers themselves feel the need to get these kind of things done to look better, to be better in their career?
Of course, there is pressure from the industry itself, from the misogynist industry, I should put it in that way. But the pressure is from a few filmmakers, casting directors, as well as the whole atmosphere in itself. The pressure lies in the social media. The pressure lies in the society. In fact, why can't it be for the men? In fact, the men don't even have to kind of lose weight sometimes. They have tummy a lot of times. But why is it only the women? So much of pressure is on them. As a filmmaker, I should, in fact, personally, I've introduced Deepika Padukone, I've introduced a lot of girls. I insist that you're actors, you're not models, or you don't want to have a zero figure. I insist on that because you're generally basically actors who have come here to perform, act. And I feel sorry to say this. I wanted to answer your question that who killed Chethana. That's a very, very, very valid and very relevant question today. In fact, I should say the misogynist society killed Chethana. The misogynist social media killed Chethana. The misogynist trolls have killed Chethana because there's a lot of pressure on the actresses. It's not just Chethana, it's Aarti Agarwal, it's Misty Chatterjee, Mukherjee, and it's in fact a friend of mine who got himself killed because he went into a liposuction. In fact, the doctor, in fact, has killed Chethana, I should say, because I, in fact, request the industry and as well as the doctors to regularize this thing, because Chethana looks slim for me. She looks thin. She doesn't need a liposuction. She doesn't need a bariatric surgery. Why did the doctor, in fact, didn't advise her? In fact, as a director, I've advised a lot of actresses that you can't lose weight overnight. You have to be fit. You have to work out if you want to be looking good or whatever for the role, for the camera. But you don't have to go through under the knife. You shouldn't go under the knife to looking good. In fact, I've seen personally a lot of actresses going under the knife just before a song, just to look glamorous, and after the song or after a few months, they're back to square one. They're put on weight. And it surprises me that overnight they lose weight and they come and they perform. And again, after 6 months, they're put on weight. There's no diet in particular. And of course, who killed Chethana? Chethana herself, because they put a lot of pressure on themselves to look good because of the social structure, because of the social media, because of the industry, and of course, misogynist few filmmakers and casting directors and the surroundings around them. In fact, I feel sorry for her father. In fact, he was crying, saying that my daughter has lost 3 liters of fat when they went into this operation. In fact, I'm surprised, I'm shocked that why not the doctor advise her? You don't need a liposuction, you don't need a surgery. Why don't you lose weight? That should come, the responsibility should come within the society and within the doctor itself. And it's high time that the industry regularize, have a body for this, for not going under the knife, for lip surgery, for nose surgery, or whatever. You look good. As a panelist earlier said, to each his own. Everybody looks different. Everybody looks good. So why do you have to go under the knife for lip surgery, for nose surgery, for losing weight, becoming a zero figure? It's very sad that a young talent who was acting in 2 serials, who was knocking at the doors of film industry. Have you lost her? How many more lives? How many more heroines we have to lose like this? It's high time that we regularize and, of course, teach, bring in the whole film society, make them knowledgeable about being fat is not looking good. Being fat, they can still look good. In fact, a lot of actresses look charming, to look very beautiful. In fact, it's all about performing. It's about art today. Why should you go under the knife and lose your life? It's very sad. Imagine her parents' position today. It's very sad. It's really,
it's
really
a tragic
sad.
end to a promising life, and family clearly is in a state of shock today. Yes, and you've also raised some important points about how there is a need to also regulate the industry. Dilip Cherian, now, how will you like to respond to what happened with Chethana Raj, what it says about the pressure that one feels to keep up with these new age fads, and also at the same time, she was just 22 years old, while, as Kasturi was mentioning, there is pressure from the industry. There is pressure that you feel from within to look even better because of the environment that you're working in. Apart from that, there is this pull that you see from these kind of clinics also, which tell you that, we can do this for you. We can make you look even better.
While we all have expressed grief at the loss of Chetna, I think that there is no getting away from the fact that the acting profession, like certain other professions, like, for example, cricket, is a very highly compressed career because of the nature of the industry. The moment you get in, whether you're 22 or 23, whether you're 43 or 44, you feel the immense pressure of a whole bunch of people right behind you, waiting to toss you over into, being a non-person. That's one. The second thing we have to keep in mind is that the marketing techniques, as well as the medical techniques available, the choices are bewildering and bewitching. So many people, many young people get beguiled into believing that they can have a total makeover using just the shortcut of a knife. And I think the fact is that you have to, as Reena said, and as Kasturi mentioned, the fact is that there are no shortcuts. This is something that you have to recognize, come to terms with, and work at on a daily basis if you have in your head an idealized image which you want to be. Now, we may have arguments about what society deems is necessary. There is a level of misogyny, and there is a level of hyper competitiveness among certain kinds of actors for the same set of roles. So, it's probably just one size difference which makes the difference between getting a role and not getting a role. And that is the pressure that the industry is throwing onto these young people's shoulders. And it's clearly something that doctors in their books of ethics should take into account, that what are they selling. The other real danger is that what we don't take into account is that there are a whole bunch of procedures today which are called lunchtime procedures, things which are done by just practitioners and not necessarily surgeons, and those are equally dangerous, and they've become kind of commoditized. So you feel that you can go out for a lunch break and come back with a self-image or a real image which is vastly improved from what you went out at lunchtime for. So we are talking of the marriage between bad science and bad practitioners. You can't tar the entire cosmetic world with that, just as you cannot tar all directors or all actors. But there are more vulnerable people, and we need to realize that as a society, we need to recognize the difference between one person and the other, and that should be made, and the quality of acting should be the benchmark in whether it's a serial, whether it's a movie, and that's what ought to be the basis of getting roles. Can we change all that immediately because of one example? My fear is that we will lose more lives unless we talk more about it and make people more conscious and aware about it.
Very important points. Kasturi Shankar, simultaneously, there are many fly-by-night operators too.
Well, yes, that's the worst part of it. As it is, these are all risks. And then if you don't go to an accredited service provider, then it gets even worse. I wanted to quickly respond to what Indrajit said about pressure being only on women. Yes, I think in the bygone days that was true. But these days, there are a lot of people who, unlike you, are extremely uncomfortable with their hairline, receding hairline, so to speak. So I have a lot of people I know walking around with things that look like a dead animal on their heads, botched hair jobs. In fact, one of my acquaintances, he had such a bad procedure. He ended up with an infection. It was a bad scene. I mean, he had to undergo a lot more medical procedures just to get his head back in order and looking like a head without all that rot setting in. So I think these days, the pressure is on men as well, not just hairlines. Now we want all our men to look like, there was a time when movie heroes at least were clothed, even though movie heroines, the female stars used to wear skimpy clothes. At least the Jitenders and the Dharmendras used to wear clothes. Today, no, even the heroes are under tremendous pressure to have six-pack and eight-pack and all that. So all the college guys are under a lot of misguided perceptions these days. So this disease is a social disease and it's growing. It needs to be checked, and this is a wake-up call for all of us. Reena ji said, it's not just about movie people. It's not just about people in the limelight anymore. It is you and I and the girl next door. This is a menace, and body image and body positivity have to be maybe made into a lesson in school at this point.
Very important, because it's no longer just limited to people who are in this film industry or television industry or in showbiz per se. It is happening in our neighborhood as well. Indrajit, I think, wanted to come in as well. Yes, Indrajit.
Yeah, I agree with Kasturi Shankar, with a lot of men also under pressure, but it's the women and in social media especially, and trying to lose weight. Of course, men go through the surgery under the knife, the protein shakes, the steroids, they like to have six packs and all that. The industry, of course, in itself is a lot of pressure. But the misogynists in the industry, they put a lot of pressure, and of course, outside the industry, in the social media as well. I suggest, in fact, they should have, especially the women as well as the men, should have the women should have counseling. They should get into this counseling. There should be some kind of a body where they can counsel them and say that you look good. You don't need to get into like liposuction or surgery or whatever. There should be a body regulating this, and there should be counseling as well, because a lot of heroines today get into depression because of this, because they put on a couple of inches or a couple of centimeters, in fact, or maybe a dress is not looking good on them. They try to kind of go into depression. I've seen that. So there has to be some counseling as well, and they have to come out in the open, be free, and it's the talent matters, it's the acting that matters, it's the performance that matters end of the day. And I feel sorry for the women who have already passed away now, and of course Chethana.
Yes, and Reena Dhaka, clearly, as Dilip Cheran also mentioned, that, overnight things are not really going to change for the industry and for the people, who go to these cosmetic surgery clinics. But we need to begin somewhere. And there's also this tremendous pressure that we see because of social media, Instagram, Twitter. What matters to a young person today is the likes, the comments, the retweets that one is really getting. So what is going to be your message to the people who are watching right now and seeing what has happened with Chethana? Because on one hand, there might be pressure from the industry, from outside, which we see happening, but also this pressure from within, that she probably had, that many still have, the people that we speak with on a regular basis. What is going to be your message? Reena, can you hear me?
Sorry, I didn't. I'm so sorry. Can you repeat?
Reena Dhaka.
Yeah, hi.
Yes, I'm trying to understand that, how today, because of industry, of course, there's pressure that actors face. Apart from that, there is pressure because of, your personal desires, your personal ambitions in life. And then there is this social media pressure as well. What is going to be your advice? Because what young people today are more interested in is how many likes they are getting on a picture that they've posted, the retweets, the comments that are coming. That's also putting in additional pressure. So what is going to be your message to the young generation?
So I lost a bit of it, but yes, I understand that the times we're going through right now, what has happened is a natural outcome of how devious and devilish the nature of this social approval has become. And it's become literally fatal. And if we've lost her to this, there are so many others, untold stories, which are probably going through these kind of situations, if not death, then disabilities, deformities, and what must be happening in their minds? Lack of faith in themselves, self-belief. I mean, there is so much of this self-consciousness if you don't look like everybody, and why must you do that? We're all unique. We're not meant to be the same size. If you want to be exactly a smaller size, take the long road there. Don't take the shortcut. Get there through hard work, exercise, fitness, whatever else. It's not like we can't achieve it. But to be a plus size also is acceptable. And as I learned from one of the panelists, she was not even a plus size. She didn't need to go under for a bariatric surgery, which is a very severe surgery in plus size cases. Sometimes it is recommended in case of the fat hurting organs. I'm not a doctor, I'm not a scientific person, but the healthcare system also needs to wake up. They need to realize they can't just brutally take our lives because of their casualness or because they're busy with the next. And the one gone by is not of importance anymore. So to have a kind of a reflective post-care surgery as a part of their routine also, where they become accountable and connected to the patients.
Very important. And Dr. Veena Singh, of course, there is a responsibility of the clinics as well that are operating in different parts of the country. In this case specifically, reports are suggesting that, one, the surgery was conducted without proper consent, and second, without proper equipment. Who checks whether the doctor who is going to conduct the surgery is informing the patient about the kind of complications the person could actually face? Do you think we need regulation now in this industry?
See, regarding your question for the consent and the complications explanation, I would like to say that it is very important for the general public to understand who is qualified to perform plastic surgery or the cosmetic surgery. So a board certified plastic surgeon is the qualified person. Apart from a plastic surgeon, none of the doctors are qualified. So please do take care that anyone who is claiming to be a cosmetic surgeon might not be a plastic surgeon. So this is my first concern. The second is that.
But what is the way to check? What is the way to crack down on the fly-by-night operators, Dr. Veena, that are also operating today in different parts of the country? Who's checking all of this?
It's like, yes, we have a National Medical Commission for checking this. This is a doctors who looks after the rules and regulations related to the medical profession. So they are supposed to check it, who performs what. And as far as the consent is concerned, it is always in written and a very elaborate consent. And each and every line is being explained to the patient. And after understanding understanding only an adult patient signs. So there is no doubt about a proper consent, because without that, a surgery cannot be performed. If it has been performed, then it is a wrong way. I do admit that. The third thing is that if you want to say that a patient comes to a surgeon for getting a cosmetic surgery done, and the surgeon denies, there is no particular reason for that. The surgeon is providing the services, his expertise. And when a patient comes with the problem, with the low confidence and low self-esteem due to some issues in the body, which might not be issues for the other, but for the patient herself or himself, it is a major personality issue. So to instill that confidence, these cosmetic procedures are meant for. I do agree that everything is not 100% safe. It is like any other surgery. Why are we forgetting the gallbladder surgery and the appendix surgery? It is also not free of any complication. So it's not like doctors who are accepting the request of the patient are doing something wrong. They are there to provide the services. They take the consent, explain the procedure. Everything is being explained in details, and you won't believe that a cosmetic surgery procedure, it takes hours of discussion and explanation, maybe more than 2 to 3 sittings. So it has to be done in very detailed. And it is not a doctor's job to discourage the patient. They have to see how well it can be done so that the patient feels confident in practicing his or her profession. He is confident
but
to
only when it is required. Dilip Cherian,
Question for this.
if we talk about a surgery, in any other part of the body, then we require it. It is required by the body. But here in this case, where is the guidance? I mean, she's just a 22-year-old. Maybe she's under pressure. Isn't it also then the responsibility of the surgeon here or the clinic where she's going to first see whether her health condition is fine or not, and to also see whether she actually needs it or she's getting it done because she's under pressure?
Heena, you have to divide
Definitely, it is the doctor's responsibility to see the indications for that particular surgery.
Dr. Veena, we
have these indications. Yeah,
yes.
We have these indications very clearly, and the guidelines laid down in our textbook.
And there are
doctor
okay, Dr. Veena, Dilip Cherian wants to respond.
For cosmetic surgery.
No, I've got a question too. Heena, I've got a question too.
I have a feeling
why can't the doctor advise for losing weight?
One second, let Dilip Cherian respond first. Indrajit, I'll come to you. Dilip Cherian first.
Yeah. I think Dr. Veena has a valid point that a surgeon's job is to make sure that the surgery, if the patient wants to have it, is something that can be performed safely with the right equipment, with the right checks and balances, and with the post-surgery complications explained. But I think there is one level of ethics above that in the case of plastic surgery, because of the fact that we all recognize as a society that there is no doubt that there's huge pressure on certain kind of people, certain classes of people. Reena has mentioned that it goes beyond the class of performers, singers, those who have to make a living out of the way their beauty is perceived by their audience. But today you're talking of several kinds of clinics which dole out advice, and sometimes after getting bad advice, they go to a good surgeon and get something which ought not to be done to them. And that is where the line needs to be drawn. We are talking of people who are impressionable, who are vulnerable, who are therefore opting for procedures which they don't need to do or don't have the physical capability of being able to take that. Now, testing and tests will do a certain part of it, but it will not cover the whole ground. So we need to understand that the proposition that any plastic surgeon must, especially when the procedure is very invasive, insist on some kind of counseling, which should be a prelude to going under the knife for a major procedure. I think that would solve some of the problems, and I think that needs to be mandated.
That's an important and a valid point you have raised. Counseling is something, if can be added to this entire structure, the way surgeries are done before the surgery, probably things will start getting slightly better. Indrajit Lankesh, you wanted to make a point very quickly. I'm completely out of time. 10 seconds, please.
Heena, I was just listening to the doctor. So why can't the doctor, in fact, I'm just asking, why can't the doctor say or advise that it's not necessary for them to operate? Because as I know, bariatric surgery, a lot of actresses have gone through this bariatric surgery. But do you know that bariatric surgery in the US, it was started first because of diabetes. Diabetic patients went through the bariatric surgery, not to lose weight, to control diabetes. But here in India, they do this bariatric surgery for losing weight. So why can't the doctor, in fact, advise these kind of actresses? Because you're in public trial. The failure and success, unlike other industries, here it's in a public trial. They go
Absolutely. And I think on this, what Dilip Cherian said becomes very, very crucial. Counseling is also very crucial in a situation like this, because eventually we all need to understand, if an adult is taking a decision to go ahead with a certain kind of surgery, it's that person's personal choice, individual's choice, and nobody can really question that. Then the role of doctors becomes really, really important. I would like to thank all my guests. I'm completely out of time, but thank you very much, all of you, for joining us here on this very, very important subject on Urban Debate tonight. We can really hope that things get better from here on. Thank you very much, all of you.